Well, as the vaccination programme continues, there is growing concern that people with learning disabilities are being overlooked. A recent Public Health England study found a mortality rate up to 6 times higher for those in this group than for the general population, but many are not being prioritised.
Welcome everybody to this seminar about the COVID vaccine. My name is Amanda Cresswell and I work with Irene. We are very good colleagues and we work together as a very good team. And I hope you saw the news clip on the BBC News, and me and my friends are very worried because we don't know what's going to happen and if we're going to have the vaccine at all.
Thank you, Amanda. And my name is Irene Tuffrey-Wijne, and together with Amanda, we're going to present you this webinar where we will show you the BBC clips again if you've missed it. And we will show a little bit more because we had a long interview with the BBC, didn't we, Amanda, with the group? So we'll show you a little bit more of those clips of yourself and your friends talking to the journalists. But also we're talking to a number of experts who can help explain a little bit more about the issues and about the reasons why people with learning disabilities need to be prioritised for vaccination. If you are watching this webinar live, then you will be able to just write your comments, questions, anything you want to say in the Q&A box, and myself and Gemma Allen, the chair of the PCPLD network, are there live behind the scenes to answer your questions and to respond. So shall we just show them the clip again, Amanda? Let's just first look again at the wonderful report of the BBC that was on the TV on the 24th of January. Let's look at that first, and then we'll move on to just sharing a little bit more with you about those clips and those interviews. All right.
Nikki Fox reports.
You know, you can't smell it, you can't see it, you can't hear it. It's like a silent killer.
Everyone here has a learning disability.
You could end up in hospital.
They meet up regularly to talk about and understand death and bereavement.
It's scary at times.
These chats have never been more important.
All I keep thinking is, am I going to be next? You know what I mean? Am I going to be the next one to die?
Just because we've got a learning disability doesn't mean we should sit in the corner and rot and then our loved ones get a phone call to say that we've passed away. We need help now.
The amount of people that have died is absolutely frightening.
All I keep thinking is, am I going to be next? You know what I mean? Am I going to be the next one to die?
I have been scared, like, you know, I know the others have been saying, you know, it is scary at times.
I think this vaccine is very, very important to us.
We need it now. There are so many people that are going to die, and it's not fair.
I think there's a lack of understanding between the government and people with disabilities, and I feel that the government is sidelining us.
Why do you feel people with learning disabilities as a whole should be prioritised for a COVID vaccine?
Even before COVID, more than 4 in 10 people with a learning disability died of a lung condition like pneumonia. Not only are they at high risk of catching the virus, but once they catch it, they're at very high risk of not getting the care that they need. It's clear that as a group of people, they really are at risk. They should be prioritised.
You could end up in hospital and you could be there on your own. I don't think your support workers or people are allowed to be with you, and I would hate to be in the hospital and end up dying on my own, I would.
We need to have the vaccine immediately.
My name is Richard Keegan-Bourne. I've got a mild learning difficulty, but I'm not shielding. I'm just in the queue waiting like everybody for my vaccine.
My name is Peter. I have a mild learning disability. With me, I'm at the bottom of the pile, so I have to also have to wait my turn to get the vaccine.
Hello, my name's Samantha Reeves. I'm not shielding, and I'm not quite sure when I'm going to eventually have my vaccine.
I'm Vincent. I have a mild learning disability and I'm not shielding, but obviously, like everybody else, I am very, very scared that of this pandemic, and the amount of people that have died is absolutely frightening, and the number of cases is absolutely frightening as well.
My name is Amanda Cresswell, and I'm shielding, and I can't go out only when I go for a walk, and sometimes I get really fed up and frustrated because I have to stay in and I can't go shopping and do my normal activities, and I miss my family and my friends. Hopefully at the top of the list after we've made this film, but I doubt it, probably third or fourth.
I'm David Jeffrey. I'm shielding, and also I don't know when the vaccination will be available yet, because I keep up with the news and everything, and it seems like the health cares and the old people and then the vulnerable people and blah blah, but there's nothing to do with disability people that I have heard of yet.
I'm Michelle McDermott. I'm shielding, and I'm not sure whereabouts on the list I could be for the vaccine, because my shielding is not just necessarily for my disability. Mine's mainly to do with my health, and hence why I can't go out because of the COVID, because it would affect my health.
Deciding who is eligible for priority access is not an easy task.
The initial priority programme was based on the risk of hospitalisation and death.
The committee which advises government examined a different set of data to Public Health England. It believes those with mild learning disabilities are not at such an increased risk.
Individuals with learning disability we recognise as a very disadvantaged group, and so that's why we decided to make a clinical decision to prioritise those with profound and severe learning disabilities within our first 6 categories.
We are now going to listen to Josh Glover. He knows about the numbers for people with learning disabilities who have lost their lives to COVID.
So hello, Giles, and thank you really so much for coming to talk to us. I wonder whether you could just explain a little bit more to begin with about how the priorities on the vaccination list have been arranged.
Yes, yeah. I think it's really important that people with learning disabilities should get a reasonably high priority for getting COVID-19 immunisations. The Joint Committee on Vaccination and Immunisation, that's the JCVI, their decision on who should have priority have mainly been based on who's at higher risk of dying if they catch COVID-19, which is obviously right. Now, the report I did, which was published by Public Health England in the autumn, showed that people with learning disabilities, basically that's people on their GP's learning disability register, had roughly 6 times the death rate of people generally. And that figure of 6 times is after you take into account the fact that relatively few of them were in the very old age groups who are most at risk from COVID-19. Most of the prioritisation the JCVI gave for who gets immunised is based on age, and that's because this is the biggest risk factor. Apart from age, there are 2 ways that people with learning disabilities get into the priority list. The first is that there's a group of people generally who are at extreme risk if they catch COVID-19, and this is called the shielding group. So they've been told to stay at home and shield themselves from catching COVID-19 even more than all the rest of us have. These people are mainly people who've either got conditions that damage their body's ability to fight any sort of infection, or who are taking drugs that suppress their immune system. And following an important research study, people with Down syndrome were added to this list in September. So this means that people with Down syndrome are automatically at priority level 4 for COVID-19 jabs, which means they should get immunized about the same time as people who are aged between 70 and 74. The second way people with learning disability get into the priority that the JCVI recommends is that they responded to the 2 reports that came out in November, my report and Pauline Heslop's report. The priority list for immunisation before that hadn't said anything specifically about people with learning disability apart from the ones who got Down syndrome. They updated the priority list in response to include people who've got severe or profound learning disability. And they get included along with other people who've got other important underlying health conditions. And that lot get immunised after people who are aged 65 to 70, but before people who are aged 50 to 60. So this should mean that most people on learning disability registers should get immunised, but the way they've specified it, the way the JCVI have specified who that is, specifies people who've got severe or profound learning disabilities. And that raises a practical problem. The practical problem is that nobody's got a list of who's got severe or profound learning disabilities. The closest thing there is to this is the list of people who are on their GP's learning disability registers. Now, I think the JCVI may have chosen to do it this way because they were worried that if they said everybody with a learning disability, this would be a very large number of people who might not be at particularly high additional risk. The study they based their decision on seems to show the additional risk for people with learning disabilities is actually quite low. And part of the reason for this is that it accounted separately for the reasons why people with learning disabilities have additional risks, like having diabetes or having neurological conditions like cerebral palsy or epilepsy. But the study also used a surprisingly wide definition of learning disabilities. So it picked up about 3 times the number of people as having learning disabilities who would have been on their GP's learning disability register. So I wonder if the study had actually included a lot of people in their learning disability group who we wouldn't usually consider as having learning disabilities. If we want to make sure that people with learning disabilities actually get COVID-19, I think the reason why they're eligible, how they get eligible because of having learning disability, needs to be set out really simply. And most importantly, it needs to be set out in terms of a list which we know everybody can actually find and everybody actually understands. And the only practical way to do this is to say that operationally, it should be everybody who's on their GP's learning disability register.
People with learning disabilities, you know, they do fall through the nets, don't they? And, you know, sometimes I think they get forgotten about. And yeah, that really worries me and, you know, worries me for everybody really for learning disability.
I think that people with learning disabilities need to have the vaccine soon because it's not fair that that we don't have it. That because we are very vulnerable, it doesn't matter if we're mild to moderate or profound, we do need it, and that because we are more susceptible, is that the right word to use, of contracting the virus, and we are 99.8% of actually contracting and dying of the COVID. And I think that we need to have the vaccine immediately.
Now we're going to listen to Baroness Sheila Hollins, and I've worked with her for a very long time.
Well, the work that Irene and the grassroots have done to highlight this issue is really, really important. With two colleagues, I wrote an opinion piece for the BMJ, which was published a couple of weeks ago, arguing the case for all people with learning disabilities to be vaccinated as a matter of urgency. We based our recommendations firstly on the fact that probably only 2 out of 5 people with learning disabilities actually reach the age of 65. And so to reach the priority group for vaccination is quite difficult, just in kind of demographic terms. Secondly, it's because the initial data that's come through, both in the UK and in other countries, seems to suggest that younger people with learning disabilities are dying from COVID. People in the 18 to 34 group, for example, were found to have a 30 times higher death rate than other members of society. Now, okay, this is based on small numbers, and I'm sure that Giles Glover will have a comment to make here. But we know that from my own research and from other people's research, particularly from the National Mortality Review, that people with learning disabilities die much younger, and they die of conditions that other people die of at a younger age. Also, during the pandemic, we know that a lot of people had do not resuscitate orders routinely given to them. So they may not even have been admitted to hospital. They may not have been diagnosed. Getting a test, putting themselves forward for a test will have been more difficult. And the cause of death may not have been accurately identified. There is a problem identifying people with learning disabilities in order for them to have the vaccination. The best way, in our view, is for everybody who is registered on their GP learning disability register should automatically be eligible for vaccination in group 4. The reason I say this is that actually it's quite difficult for GPs to identify the people that the Joint Committee have suggested, people with Down syndrome, people with severe and profound learning disability. They're not categorised in that way. If they're known to their GP as having a learning disability, they're known because they're on the register. And that's probably 10 times as many people who've currently been recommended for the vaccination. This does mean that people who aren't registered with their GP as having a learning disability wouldn't be eligible. But perhaps this would be a good opportunity to remind people of the values of being identified. One of these is, for example, that if you are on the GP learning disability register, you're entitled to an annual health check. You're entitled to an annual flu jab. There may even be advantages for the people who provide you with support. If your carers, for example, are on the carers register, they might also become eligible. There are many more people with learning disabilities who could register with their GP and may get better health promotion and improved access to healthcare by doing so. Although I can see that there will be people who feel that they might be left out, this would be a perfect opportunity for them to step forward and say, I'm learning more about how having a learning disability means that my health outcomes may be worse, and perhaps registering would be a good idea. It would be my way of being a bit proactive, putting myself forward for better health protection than by remaining off the register. So that's one good idea that I have. You know, it's difficult to justify, in my view, why a person with a learning disability should be given or seen as a lower priority for vaccination than an otherwise older, healthy adult who doesn't have a learning disability. And also people who live in a care home with a learning disability aren't eligible for vaccination, yet they share many of the same risks living in a congregate setting as older people. So that's a problem. I think a vaccine policy which doesn't account for some of these kind of social and communication issues and educational issues which people with learning disabilities experience is frankly discriminatory. And really, the policies have failed to make reasonable adjustments as required under the Equality Act. It just doesn't seem to me that the Joint Committee has actually understood the complexity which those of us who've been working in this field have been struggling with for years, how to deal with the health inequalities, which are not just down to the biological and physiological aspects of the person's lived experience, the lived condition, but to do with some of the discriminatory attitudes and social inequalities that they experience generally. It's a relatively small group. Why can't they be prioritised at this time rather than yet again marginalised and left on the side forgotten?
What makes this one dangerous? People die from it.
I know a lot of people affect, because I do sometimes get a bit anxious about things. In fact, I think that when you've got a learning difficulty, it's a lot harder for people to understand things. In fact, I think that if the vaccination could be given out sooner, that would help to release some of the anxiety what people have with a learning disability, and then they can get back to their lives, because a lot of people with learning difficulties don't have a social life like everybody else do, because they find it hard to mix with outside people. And that, now their groups are closed, what they go to, because a lot of people having to shield, but also people with more learning difficulties can't go into place because of the virus. Yes, or spreading it or something. Yes.
Our final speaker is Dr. Kirstin Lamb, who is a retired GP.
So thank you, Irene. As GPs, we already know that people with a learning disability well before COVID experienced significant health inequality, with women with a learning disability having a median age of death about 26 years younger than the general population, and men about 22 years younger than the general population. And then COVID comes along, and as we've already heard, the death rate from COVID has been phenomenally high. So how can GPs try and support their learning disabled population, thinking about their protection and vaccination? There are many areas that are using the flexibility to reduce health inequality clause within the JCVI recommendations to actually prioritise their learning disabled population. And it's worth contacting one's CCG or public health experts locally to see what the local stance is on that. In particular, that's important for those in a residential care setting. Then if we move to the current JCVI guidance about who should be prioritised and in which group, we know that group 4 includes those that are clinically extremely vulnerable. We know now that people with Down syndrome are included in that group. Those people all your patients with Down syndrome should have been found and should have been sent the letter telling them that they should now be recognised as clinically extremely vulnerable. That also then includes guidance about vitamin D supplementation, for example. So then if we think about who could fall into the group 6 criteria, so those are people with other health conditions, this group 6 is now very broad compared with similar long-term condition guidance for other vaccinations. So I would suggest that it would be really useful if GPs could actively look at the patients they have registered on their learning disability registers and really sort out which of those patients will easily fall into group 6 and make sure that those patients know that that will be true. There's a lot GPs can do to try and support the population. On reviewing the register, there will be many long-term conditions such as congenital heart disease, recurrent aspiration pneumonia, and so on, where people will fit into the priority group 6 area. I would also say that there will be many people with multiple long-term conditions, and the GP could therefore consider whether those people should be offered the clinically and extremely vulnerable letter, which would automatically move them up to group 4. So I think there are a lot of things that GPs could do to ensure that the current health of people is good. They've considered annual health checks, they've given the flu jab, they've reviewed the list to sort out exactly which current priority group all their patients with a learning disability will fall into, and contacted families and care providers to ensure everybody knows the outcome of that.
Thanks, Kirsten, and that's really very useful. Can I just ask, I mean, it sounds like, as you say, a lot of people with learning disabilities who are on the register for GPs as having a learning disability will fall within some sort of clinical vulnerable group that they can therefore quite legitimately prioritise within the current guidance. Is there any way that, I mean, wouldn't it be much simpler to say, well, there's so many of them, let's just do all the people in this group? That will save us a lot of work and effort.
I quite agree. It would make it very much simpler. And until the guidance changes, unfortunately, we have to work with the guidance. And as I said right at the very beginning, there are areas who are just saying, because it's so much simpler, we will just do the whole learning disabled population and prioritise them, even prioritise them in group 2 because of their extreme vulnerability and because they're small numbers. Yeah. Currently on GP registers, the prevalence is only 0.5% of the population, and I think in total in England that's only about 250,000 people. So it's not a large group, and it would make such a huge difference to this group to be prioritised. And as you say, it would be so much simpler if we could just give the vaccine, offer the vaccination to the whole group.
And you're saying that some areas are already doing that? Is that what you just said?
I have heard this. I can't say precisely. I know many areas who have definitely included people in learning disability residential care settings within the same priority group, in other words, in group 1, along with elderly care settings.
Well, thank you very much, Kirsten. That has been really useful to listen to you. Thank you.
We're just as important as everybody else that should have a chance of having the vaccine, but we need it now rather than later.
Death after death and case after case, I just can't cope with this.
Legal action on the grounds of discrimination is being taken against the government. However, the Department of Health and Social Care says it is working hard to vaccinate all those at risk.
They should be on top of the list.
But with learning disabilities being such a complex, often misunderstood condition, campaigners believe that once again, this group of people are being forgotten. Nikki Fox, BBC News.
Thank you everybody for coming and joining this webinar, and I hope everybody is going to listen to our message, and I hope that we get priority higher than we are now.
Thank you, Amanda, and thank you very much from me as well. As Amanda said, it's such an important issue, so I really hope this has got you all thinking and really trying to do the best we can to make sure that people with learning disabilities, all of them, get vaccinated as soon as possible. This webinar was brought to you by the PCPLD network. We are a small charity, palliative care for people with learning disabilities. If you are able to give any donations, then that would really help us to keep the webinar series going. And the details are here on the screen. Our next webinar will be on the 9th of February, which is on a Tuesday lunchtime, and that will be on bereavement and people with learning disabilities. And Amanda, you and your grassroots group friends are going to be in that webinar again as well, as is Sheila Hollins and myself as speakers. So if you are interested, then please sign up and join us for that webinar as well. Thank you very much, and we hope to see you again.
I think people with a learning disability should get the vaccination because it will. Oh, sorry. Oh, yes. Sorry. Oh. It's a good treat. I'll call him back. Sorry.